Hello, everyone. I'm Zhang Jingpu from Shanghai Public Health Clinical Center in China. Today, I'll give a talk about DNA templated silver nanoclusters that have tryptophan for combined detection of plasma tryptophan and albumin in sepsis. Firstly, I'll introduce the background, and then I'll introduce my talk from the construction of our nanosensor to the photochemical properties of the nanosensor, and to the sensitivity and specificity for our nanosensors application for tryptophan detection, to the final application of the method in the plasma tryptophan and the HIC detection. Finally, I'll give some summary and highlights. Tryptophan is an essential amino acid in human body. Most of the tryptophan catabolizes along the kynurenine pathway, so in like this flow, and it is transported by binding with several albumin in the circulating system. As we can see that tryptophan can generate many metabolites, and they all have very important functions in inflammatory programming and immune regulation, especially in sepsis disease. Sepsis is defined as life-threatening organ dysfunction caused by a dysregulated host response to infection. However, in the older definition of sepsis, most of the research thinks that sepsis patients have a lot of rapidly changing inflammatory factors, like factors anti-inflammatory or those pro-inflammatory factors. Therefore, a variety of factors makes monitoring of sepsis much more difficult. So, is there a single biomarker for sepsis monitoring? It has been reported that tryptophan is decreased in non-severe sepsis patients. In severe sepsis patients, and the ratio between kynurenine to tryptophan is increased in the non-survivor of sepsis patients. Therefore, tryptophan would be a potential biomarker for sepsis monitoring. However, the current tryptophan detection methods are mostly depend on LC mass or HPLC. Most of these methods rely on, as you know, large instrument and is time-consuming. Although some novel methods has been developed, such as methods integrates electrochemistry or nanomaterial to tryptophan aptamer. However, these emerging methods usually have two band specificity to be used for clinical use. So anyway, it is interesting to know that aptamer to tryptophan has been developed, and Such a aptamer holds great promise in areas such as biosensors and nanotechnology. And what we want to do is to increase tryptophan aptamer to fluorescence-based detection methods in an easy way. We found the easy way to detect tryptophan based on DNA templated silver nanoclusters. What's DNA templated silver nanoclusters? They are silver nanoclusters generated along linear DNA, hairpin DNA, or double-strand DNAs, especially DNA who has series region would collect silver ions around here. One hybridized strand come here to hybridize with a signal strand, then there will be an fluorescence enhancement as high as 500 fold enhancement, what we call as J-rich sequence hybridization fluorescence enhancement. That's very important for hybridization-based molecular detection. And there are many advantages for the templated silver nanoclusters. First, moleculars can be recognized just by hybridization based on base pairing principles or aptamer-based recognition principle. And the DNA templates for silver nanocluster generation can be modulated by changing the length or sequences or structures of the DNA templates. Thirdly, there's no need of covalent modification. And DNA templated silver nanoclusters has been reported for metabolites detection, but not tryptophan. Therefore, here we develop a strategy to light up tryptophan based on DNA templated silver nanoclusters. In our strategy, it contains a signal probe. In the signal probe, there are two regions. One region is series sequences and 3-end, and the other region is a complementary sequences that can hybridize with capture probe. Yes, the other strand is a capture probe in our strategy. In the capture probe, what's we call G, it has it contains a G-rich overhang and it's bivand, and the tryptophan aptamer and its 3-end. Once the signal probe, what we call the C, was hybridized with the capture probe hairpin G, we can obtain the hybrid CG without any influence of fluorescence. In the absence of tryptophan, the hybrids, what we call the CGT, can emit enhanced yellow fluorescence. In contrast, in the presence of both HSA and tryptophan, the hybrid, what we call CGTH, show little fluorescence again. In the table, we show the sequences of the present probes, all their elements in our study. Firstly, we shortened the series by varying the complementary sequences that can hybridize to the capture probe, we obtain a variety of signal probe, and we conduct the optimization and found that SH3C one hybridized with the hairpin G capture probe can show the enhanced fluorescence compared with hybrids in the absence of tryptophan. Therefore, SH3C was adopted as a signal probe, and from the electrophoresis results, we can see that with the decrease of the complementary sequences in the signal probe, the hybridization efficiency was reduced. However, the fluorescence was the fluorescence shows the highest. So SH3C with reduced hybridization doesn't affect its fluorescence properties. Later, we optimize the stoichiometric proportion for preparation in template silver nanoclusters, and we determine the ratio as 1 to 40 and 40 for the preparation of silver nanoclusters. Next, we screen the capture probes, and by varying the J-rich over Hong in the capture probe, we can see that hairpin G shows the highest enhancement after the addition of tryptophan. Therefore, hairpin G is selected as the optimal capture probe, coupling with the SHC templated silver nanoclusters for the further experiments. Furthermore, we explore the aptamer dependency of our nanosensor, and we found that with the shortening of the aptamer length, we can see that the fluorescence decreased. Therefore, the full length of tryptophan aptamer in hairpin G is critical for fluorescence enhancement effect of our nanosensor. We further want to uncover the underlying mechanism for our nanosensor to light up tryptophan. Hence, we explore the photochemical properties. Firstly, one silver nitrate and sodium borohydride wasn't added into the signal probe that's in template C. There will be no fluorescence because there are no silver nanoclusters generated around the C template. And secondly, we found that with the increase of the time for UV radiation, the system CG and CGT hybrids can reach a peak around 30 minutes UV treatment. It can be concluded that the nanosensor exerts a J-rich sequence-mediated and several nanoclusters-dependent fluorescence enhancement effect by the addition of tryptophan after UV irradiation. What's more, we want to uncover the conformational changes. As you know, the effect of conformational changes on the fluorescence of our nanosystem by characterizing the circular dichroid spectra. From the CD spectra, we can see that tryptophan makes a system respond to the CD signals. And after the addition of tryptophan from the TM images, we can see that the several nanoclusters has shrinkaged sizes that's below 2 nanometers. And these sizes of several nanoclusters can contribute to the fluorescence emission. Furthermore, we explore the effect of UV irradiation on the properties of our nanosensor. We can see that without UV irradiation, there will be no fluorescence enhancement, and the CD spectra, so that only after UV irradiation there will be a characteristic CD signal. And after UV irradiation, for CGT system, there is a shift of absorption peaks from 423 nanometer to about 460 nanometer. And this is the reason the why several nanoclusters can be excited to show fluorescence. And from the decrease of the absorbance, we can deduce that there may be competitive binding of tryptophan ions and silver ions to pyrimidine. Therefore, we can conclude that, different from the mostly used aptamer-based biosensor that simply induces conformational changes, our nanosensor relies on primarily the UV irradiation triggered photochemical reaction between tryptophan and silver, as well as local conformational changes on DNA probes independent of UV treatment. Hence, by just heating the hybrids, we can obtain the detection signal the same as the same as the treatment of mixing this, detection members. Therefore, just heat, mix our detection elements, we can achieve the final detection of tryptophan. Furthermore, we evaluate the sensitivity of our nanosensor for tryptophan detection and determined it as 0.43 micromole, and the detection linear range lies in 0.05 to 16 micromole per liter. Next, we explore the specificity for tryptophan detection by detection the isomers of L-tryptophan and its catabolites such as kynurenine and its mimics who have indole group, and the other two aromatic amino acids members are tyrosine and phenylalanine. Finally, we found that our nanosensor gives special response to indole group without 5-hydroxy occupation, and the interferences come from mimics of tryptophan of substances who have indole group. However, it is fortunately to know that these substances usually have trace content in plasma. Therefore, their interferences may be neglected. Next, we explore the effect of plasma components on our nanosensor and found that HSA can quench the fluorescence of our CGT system. And in contrast, HSA appeared to act the same as hairpin G to help light up several nanoclusters. What's more important is that the several nanoclusters possess its fluorescence emission in the matrix of sodium chloride. This phenomenon challenges the traditional notion that chloride ions can quench the silver nanoclusters. And the linear decreases can be found by adding the different concentrations of HSA for both CG and CGT system. Before the plasma application of our nanosystem, we optimize the plasma detection system. Firstly, for plasma HSA detection, by adding different concentrations of tryptophan, we found that 100 micromole tryptophan was added to CG system. Patients with different concentrations of HSA can be distinguished. Therefore, this concentration was determined as final HSA detection condition. And the plasma tryptophan detection system was also optimized. Firstly, we conduct NEFA treatment for total tryptophan detection by adding 100 micromole sodium laurate to make the tryptophan bound on HSA to release from the albumin. And we found that 100 micromole sodium laurate performed better, and this was used for further experiments to obtain the disturbance removing conditions for tryptophan detection. We found that once substances like indole or 5-hydroxytryptophan who have indole group have when their concentrations are below 1 micromole per liter, their interferences in the detection of tryptophan by our system can be neglected. Finally, 1 microliter plasma without any treatment was directly used for HSA detection by the CGT system containing 100 micromole per liter tryptophan, and 6 microliter plasma after deproteination or combinational treatment of replacement and deproteination was used respectively for free and total tryptophan detection. And the measures was compared with traditional or clinical detection methods. They have the similar results, implying the successful establishment of our methods. In summary, here we develop a simple combined detection method for tryptophan and HSE in plasma. It can be achieved just by firstly mix the signal probe C and chemistry probe G with the untreatment plasma or plasma treated by deproteination and NEFA treatment. Secondly, the mixture was treated with UV radiation for about 30 minutes, and finally we can achieve the detection on microplate reader or fluorescence spectrophotometer. In the end, I want to give some highlights. Firstly, an interesting phenomenon was found that tryptophan triggered fluorescence enhancement of DNA templated silver nanoclusters upon UV irradiation. Based on this phenomenon, improved limit detection for tryptophan was achieved for fluorescence-based detection. Thirdly, the combined detection of tryptophan and HSA was easily conducted merely by mixing and UV exposure. Fourthly, the nanosensor can resist physiological level of sodium chloride in plasma, which challenged the traditional notion that DNA template silver nanoclusters can be easily quenched by chloride ions. Finally, the simple method developed here might lay a foundation for future sepsis monitoring in a simple way. That's all. Thanks and questions.